Absolutely.
Alrighty, and if you'd start by saying your first and last name, spelling it, and your title.
I'm Martha White, Whyte. I'm the Regional Medical Director for the Office of Public Health.
And it is very nice to meet you for the first time.
Yes.
And so we're here to talk about the vaccine now being offered to kids 12 and up. So tell me, why should kids get this?
So, all of us need to be vaccinated if we really want to keep moving forward towards the normalcy we're all seeking. We are seeing increased infections in younger people. Of course, as elderly people 65, 50 up are getting vaccinated at higher numbers, of course, the disease is going to show itself more prominently in people younger who are not being vaccinated as we get out and move about and do more like we want to. Um, for children, it's important because we hope that we can move forward with some more normalcy in schools. I know school is about to be out, but we're about to start sending our children to camps, to, practices for sports and of course, out with friends and sleepovers. And so the more that we protect them, the less we're going to spread it to people who might be at higher risk.
And what are some questions that you're getting from parents about this now being available?
So, of course, people are most concerned about the efficacy and the safety. The Pfizer vaccine, this study for children 12 to 15 really had excellent results. 100% efficacy, which, rarely do they say 100%. Now, is that, but also very, very, very minimal to no side effects that they've seen, or where people have complained, or like we see in adults. So it's really had amazing. The studies really showed amazing results, and so I want parents to feel confident and comfortable that this vaccine is good and safe for their children. And I do think it will become one of those vaccines that we're used to seeing around, and hopefully they'll move forward with vaccinating. I know we're doing some vaccines already in schools for high schoolers, and we're going to start going back and offering it for middle schoolers, and hope that parents will take advantage of that.
And how was this exactly vetted? Was it through the clinical trials?
Oh, absolutely. Yes. And in fact, some of the clinical trials were done here in Shreveport through Dr. Van Cherry's, group. He's been part of that clinical trials from the beginning with Pfizer, and continued, and is actually starting now even in younger children. I believe they just started that yesterday. So, but they were very much studied. There were people who volunteered with their children to have them receive the vaccine, and literally hundreds of children were vaccinated, and that's how they followed them to see, did they have a good response, did it have a good efficacy, and did they have any issues with the vaccine, and they had excellent response.
And will they receive the same vaccine doses as an adult?
Yeah, so in this age group, yes, there's been no change to the vaccine for children.
And what side effects could someone of that age experience?
So we really did not see very many, issues with children of this age group getting the vaccine. Of course, like we all have seen, your immune system is going to respond to it. So you may get some warmth or a little irritation at the site, a little pain, may or may not. Some people don't have that. And then some people do have a little fever or flu like symptoms, just meaning that your immune system is really responding well. Haven't seen a whole lot of that in children, but that is something that you could see.
And how many doses of this vaccine are we having to order additional doses of the Pfizer now that it's being offered to kids 12 and up?
I wish. I wish. We have a lot of vaccine on hand because we need more young adults your age and up receiving taking the vaccine. We have, this age group from 20 to 40 where we're really not seeing the best uptake in the state. And we really hope that we can encourage people to realize that while you may be young and healthy, I've talked to an ICU doctor just the other day and had three mid 20-year-olds in the ICU just in one of my hospitals in Shreveport. So it's not totally benign necessarily to people in their early adulthood ages, but we feel like, people feel like they're invincible when they're that age. They're young and healthy and nothing's going to really harm them. But besides protecting yourself, because you can really become sick with it, if you don't, you still can spread it to people who could become sick with it. And then the other reason why we need people vaccinated is we don't want a reservoir where this virus can grow and change. And we see these variants develop that could be a higher risk to all of us, right?
And I am going to change our view 1 second here. Okay, there we go. And so, tell me, I was reading something where a lot of parents are saying, well, we're not seeing a lot of kids show signs of COVID-19. So, why should I bring my child out to get the shot?
Well, there are children that have been hospitalized with COVID. We've had, several children in this area that have had that MISC, which you've heard of, which is that kind of over response of their immune system. Several in this area. And so it's not totally benign to children. But just like with any illness, it's not just in vaccination, it's not just to protect your child, but it's to protect other children that may be immunocompromised or be at higher risk, that they may go to school with or go to camp with. And it's also to protect people that they're around in their homes or at church that they may expose if they're carrying that virus to someone else. So it's not really just about your child. Your child is very important, and we want to make sure they stay healthy. And they do have a risk, although it's slight. But it's also to protect the people they're going to be around.
And so, like you said, is this going to start being administered at schools? Where are we starting in our area as far as getting the
So
vaccine out?
so Dr. Van Cherry and his vaccination strike teams, as well as the National Guard, they actually have been out at several of our parishes in their schools vaccinating for high schoolers. Still continuing that, but now adding this middle school age group. Today, they're going to be at Airline High School vaccinating for 12 and up. And so we're excited to be offering that to the that Bossier school, and we'll be moving to Parkway and other schools in Houghton as well. And they've also been in Caddo schools, Webster Parish schools. So we are offering it that way. Of course, they can go to any site and receive their vaccine. It doesn't have to just be through the school, but we were trying to make that offer before the school year got out so that hopefully they could be vaccinated and wouldn't have to worry about any of the events that they might want to attend during the summer.
And so today is basically the first day that we're seeing kids 12 and up get the
Yes,
shot. And it's
that's
starting at
exciting.
Airline High School.
Yeah,
Pretty cool, pretty
it
cool.
is. It's
Awesome.
exciting. And I think, every step we take towards getting more people vaccinated is a step we take away from where we were this time last year, right? We definitely don't ever want to go back to that situation.
And it's keeping, kids in the schools. And so what all do parents need to bring to make sure that their kids can get the vaccine?
Just themselves and their child, and they will sign a consent when they register. If they register online for an event, for Dr. Van Cherry's, for example, they can do a consent online. A lot of places will have a written consent, or they may just sign through their electronically, but they will have to sign a consent, anyone below 18. um, just to make sure that the parents are aware that they're getting vaccinated and are comfortable with them being vaccinated. So we want to assure that, but they don't have to have an ID. They don't have to have anything. Just themselves.
And lastly, just to make sure that I'm not leaving out any questions, like you said, we have a big age range from 20 to like 40 of people not getting the shot. And now we've opened it up for kids 12 and 15. And some of those people in that age range are parents. So,
Right.
how do we get them to get their child vaccinated?
Girl,
What's
if
the
you have the
push?
answer to that, please share it with me. No, I really think it's really just giving people information and getting them more and more comfortable with the vaccine. I think there was a lot of questions about, how the vaccine was developed. There were a lot of questions about possible side effects, and I think as we've literally had millions of people around the world now vaccinated, and they're extremely safe vaccines. And so I hope that as they see their friends and they see um, family members vaccinated, pastors and people that they respect, that hopefully that will help them feel more comfortable. And then I hope that we as a community can start thinking about our community and not just about ourselves. That's been something I've really tried to stress as we've gone through this event is we have to think about our neighbors and our friends and our family members that while we may be okay, um, they may not be if they get it. So vaccinating ourselves is really not just for ourselves, but to take care of those people that we love and care about.
And I think that is all the questions. I'm trying to make sure because I think I'm going to do like a Q&A kind of form here. And I just want to make sure that I have everything on
Sure. And
question.
there is if families, like if parents have questions, there's a 1-800 number. Do you want that?
Yeah.
It's 855-453-0774. They can answer questions. They can help them find where they can get a vaccine if they're having issues. It's also to help homebound people find vaccines. So that's a great number for the public to have. And I believe that in the press release that LDH did about this, they gave there's going to be a webinar where they can do a Q&A for parents. And I think it's June 5th. Let me see. I have it right here. June 3rd from 5 to 6:15. And so that is another option for them to be able to ask if they have specific questions. They'll have experts on that can help them with that.
Okay, okay. Because I think we've kind of covered the bases of everything. Because I know people are going to ask, like, okay, this became available to adults so soon, and now kids 12 and up can get it.
So
How
one
did
thing
you
I
answer
try
that?
to tell people is that it's really not as quickly as people think. So, the research and the development of these vaccines started all the way back with SARS, which was a coronavirus, just a different one. And then when SARS didn't spread all over the world, as far, they kind of put that research back up on the shelf. Then MERS came along. They pulled that research and pushed forward with it. And then that didn't spread as well. And then came COVID and it did spread. So they had several years of development worked on prior to COVID-19. They just had to adjust it a little bit for the specific virus of coronavirus, specific strain. So it's been in development for some time. The other thing that changed was the financial requirements for companies. That it's really expensive to develop a vaccine, and some of those financial constraints were released from these companies. They were able to really put the work in and the time in without that issue. So that helped as well. So it's really, there wasn't rushed to development. It really was developed over time. And it really is it's an amazingly safe and clean vaccine that has no preservatives. It's just a really neat the way they made this vaccine is really a neat way, and I think it's going to be the way that we see a lot of our future vaccines made.
Do you think, is this too early to ask? Do you think this could potentially become a booster for?
I think we will probably have a booster, and then whether that's a yearly thing like with flu, I don't think we know yet. But I do think that most of the scientists that are following the data are feeling that there will probably be a booster down the line. When exactly, I'm not sure, like from your last shot, but I do think, yeah, we'll probably see at least one.
Alrighty, well, thank you so much. It was a pleasure meeting you.
Oh, anytime. If you need anything, just holler.
Alrighty, thank you. Bye
Okay.
bye.
Take care.